Welcome to the CTSNet, Women in Thoracic Surgery, and European Society of Thoracic Surgeons, Women in General Thoracic Surgery webinar entitled Evidence-Based Update on Women in Cardiothoracic Surgery. This is webinar 1 of the 3-part series, Women in Cardiothoracic Surgery, Advancement Through Collaboration. Thank you for joining us. Please note this webinar is being recorded and will be available next week on ctsnet.org and CTSNet's YouTube channel. At this time, I'm pleased to introduce the co-moderators for this webinar, Dr. Mara Antonoff and Dr. Deborah Brescia. Dr. Antonoff is an associate professor of thoracic surgery and the program director of education at MD Anderson Cancer Center in Houston, Texas, in the United States. Dr. Antonoff is involved in leadership and membership roles in many cardiothoracic surgery organizations and societies around the world, including her role as current president of the Women in Thoracic Surgery. Dr. Deborah Brescia serves as a thoracic surgeon an assistant professor of thoracic surgery at the Humanitas University Hospital Milan, located in Milan, Italy. Thank you for leading this discussion, Dr. Antonoff and Dr. Brescia. I'll turn the panel over to you.
Thank you so much, and thank you to our audience for taking the time today to explore this topic. I think we've got a number of phenomenal presenters today, and I'm very excited to hear what they have to say. I'm also thrilled to introduce this group of esteemed physicians to our audience. I'd like to introduce to you Dr. Minerva Romero Arenas, an endocrine and general surgeon at New York Presbyterian Brooklyn Methodist Hospital. She's an assistant professor of surgery at Weill Cornell Medical College and the president and founding member of the Latino Surgical Society. We thank her for joining us today from New York. I'd also like to introduce Dr. Tanisha Rajah, who is a trainee at the University of Birmingham in Birmingham, England. I'd also like to introduce Dr. Paula Ugalde, who's the director of minimally invasive thoracic surgery at Brigham and Women's Hospital, an associate professor of surgery at Harvard Medical School, and we thank her for joining us from Boston today. And lastly, Dr. Stephanie Chang, who's an associate professor at NYU Grossman School of Medicine, where she's the surgical director of lung transplantation and at the NYU Langone Transplant Institute. We also thank her for joining us from New York. Thank you very much to all of you for being here, and thank you, Dr. Brescia, for joining me today as a moderator.
Hello, everybody, and thanks to Mara for the introduction. So I would like to mention that our viewers may type questions for any of the panelists at any time by using the Zoom Q&A function. There will be one presentation provided by each panelist for a total of 4 presentations. A Zoom poll will also appear before each presentation, and we encourage you to answer each question. The results will be shared directly after. So following the first presentation, the panel will open to general discussion with input from the Q&A.
Without further ado, we'll ask Dr. Romero to open with the importance of affinity meetings.
Thank you so much. Let me go ahead and get my slides up. And I appreciate and I'm very thankful for the opportunity to share this topic with the audience. And I'll disclose that I'm sharing this from the perspective of being part of the leadership of the Latino Surgical Society. So some of my data will be specifically based on my experience with the organization. So I have no additional disclosures, except that my perspective comes from my individual experiences and background. We'll start off with just noting the surgical workforce and the medical workforce specifically has remained relatively unchanged for decades. We have really not seen a significant change in the representation of underrepresented groups in medicine. And you can see that across, even though we've had an increase in the medical, US medical graduates, really the proportion of represented groups has remained the same, particularly noting that American Indian or Alaska Natives remain at less than 1. You actually cannot see them on this graph because they sort of have just remained as this line at the bottom, and Hispanic, Latino, and Black or African American US medical graduates remaining at less than 5%, depending on the data that's being looked at. Looking at specifically the medical schools that graduate Hispanic or Latino medical graduates, really the majority of medical graduates in the US come from these schools, which include the 4 schools in Puerto Rico, 5 medical schools in Texas, and then 1 each in the states listed. So we really have had a great strides towards increasing representation, as you can see from the highlighted area of this pie chart. When we look at faculty level data, we also note that there has been little progress in the number of underrepresented groups in medicine. And you can see that across all rungs of the spectrum, whether you're looking at assistant, associate, or full professorships, you really are not seeing a significant change in the number of represented groups. And when we look specifically at women academic surgeons, you can see that the numbers are even more dismal, with some of these groups having 0 representation in the various rungs of academic strata. When we looked at specifically changes over a span of just over a decade, we actually saw no significant change in the number of academic surgical faculty at all levels. When we looked at the Black or African American surgeons, you can see that although there was an N number change, the actual percentage did not significantly increase. And when we look at Hispanic or Latino academic surgical faculty, we actually saw a significant decrease in the number of academic surgeons. Unfortunately, while we like to say that the new generations are going to change our surgical workforce, the truth is that residents from minority backgrounds specifically have been shown to be at higher risk of attrition. And we know that surgery has one of the higher attrition rates amongst medical specialties. 2 of the factors that were identified to be associated with attrition included women residents and Hispanic or Latino residents. Part of the concern with the Hispanic or Latino residents, as you'll see, is that this study tracked them out up to 9 years into their training, given time to account for the full training, including research time and fellowship time. And you can see that the Hispanic Latino residents had late attrition even into the senior or chief years of residency training. Other factors that were associated also included being from a community, from an academic over a community program, and residents in military training. And looking at dismissal specifically from surgical programs, this also demonstrates among surgical specialties just what a high disparity there is in terms of dismissal from surgical training programs, where we saw that actually Black or African American residents were at such significantly higher rates of dismissal. You can see that in these light colored blue bars on the graph, and you can see how that group, although they're grossly underrepresented, they also are dismissed from training at a significantly higher rate, followed by all other URIM groups and women. So unfortunately, we're really just not seeing the changes that we would like to see in the future generations. And women physicians who identified as Hispanic, again, continue to really be in the underrepresented in our specialties. I just want to highlight that, again, we're seeing just gross underrepresentation. You're looking at these numbers really being in the single digits when we're looking at Hispanic or Latino physicians. So with that in mind, this is part of why these identity organizations or affinity societies have been established. This is an image showing the founders of the Latino Surgical Society. This is an organization that we started actually while we were all residents in training. And I'll walk you through just the process of going through founding the LSS. It started really from a very small meeting. We decided to establish an organization to cultivate, nurture, and support the advancement of Latino surgeons, and really slowly started to build up our membership and the interest and building the community. As you can see in this photo, just within the span of a year that I've shown you, seeing just a big change in the representation and the numbers. This photo includes residents, faculty, students, and showing the growth in terms of being able to partner and have, again, building community at various meetings, including surgical subspecialty meetings. And this picture on the left side of the screen is from the Academic Surgical Congress. Partnering with other organizations to, again, create forums where our members could present their research work. And ultimately, this was our first symposium. This was a symposium that we hosted in San Juan, Puerto Rico. This was shortly after Hurricane Maria had devastated Puerto Rico, and we felt that it was important to demonstrate solidarity towards the island, and therefore we hosted a symposium there, again, showing just various generations of surgeons and learners. And then just before COVID, we were able to establish a presence again at the American College of Surgeons and the Academic Surgical Congress, again, creating opportunities for mentorship and for professional development, and transitioning, unfortunately, to web-based programming during the pandemic. Thankfully, that actually worked in our favor simply because there are so few surgeons usually at each institution. And so we were able to work on developing infrastructure, amplifying messaging, and amplifying the growth of the organization through social media, and creating opportunities for our members to really connect with the organization. We're able to establish an advisory board. In 2021 through 2024, this included high-profile surgeons who actually have all agreed to, mostly agreed to continue on an advisory board for a second term. And we had an advisory board of 8 physicians and surgeons. And we did feel that it was important to include a little bit of diversity. So not all of our advisory board is comprised of Latino surgeons. We included women, men. We have representation across the sexual gender minority. And actually, in our inaugural advisory board, we included Dr. Maria Soto Green, who is not a surgeon. Looking at the future, we recently had 2 advisory board members step down, and we've now introduced 2 new advisory board members, Dr. Romero and Dr. Wexner. So as I noted, LSS has really continued to build our programming. We felt that it was important to build these types of targeted programs that will benefit our members. What are the things that we do? We have Inside the Operating Room, which is an opportunity to profile high-achieving surgeons, sort of to be able to provide role models, particularly to trainees and to students. These have actually been very highly welcomed webinars at all levels, really. We have even surgeons who log on. We have pre-medical students even who log on and have expressed how inspired they are by the surgeons. We've also targeted programs for residents in training. That includes our Cafecito and our Sewing Success series, aimed at, 1, creating community and opportunities for near-peer mentoring. And the Sewing Success is specifically designated for preparing for fellowship applications. We also host once a year Pass the Baton, which is something that we're doing to provide mentorship for new incoming interns each summer. So in addition to our internal programming, we have established partnerships and various programming with the other affinity organizations, recognizing that we share a lot of similar challenges and that we have a lot of the same goals in mind. You can see the timeline here in terms of when these organizations have come into play. And actually, I should note that we, in addition to the Association of Women Surgeons, the Society of Black Academic Surgeons, Society of Asian Academic Surgeons, and LSS, we now have the Association of Out Surgeons and Allies, who have created a new space for a much needed community. And only in the last year, the Native American Surgical Society, whose logo I do not have up here, and I apologize for that, has been the most recent organization aiming at creating, again, similarly, opportunities for professional development and growth for surgeons from these groups. Why are affinity organizations important? We've definitely recognized the opportunities to nominate surgeons who otherwise would not traditionally be considered to national awards, to represent at national and international organization, to serve on boards where we traditionally have not had a seat at the table. And we've offered additional support, such as letters for research, opportunities to develop research collaboratives, and also to build their academic portfolio. And so we've partnered with a journal, the American Journal of Surgery, to provide space for LSS members to publish. We recently hosted another symposium, and so our symposium papers are going into this special issue in the journal. And it's also created an opportunity for people to serve on the editorial board. To give you an example of some of the partnered programs that we've had, we've collaborated on travel awards to surgical conferences. We've partnered on mentorship programs where we're able to partner not just underrepresented trainees to underrepresented surgeons, but actually being able to do what we call discordant mentorship. And the truth is that with the numbers that we have, it's really important that we have all hands on deck. And we really can't have like the 2%, 3% of like women surgeons only mentoring the, 2 or 3% of students. And so we really think it's important to provide cross-cultural mentorship. This is an image from our recent networking launch at the American College of Surgeons, again, showing just the growth and the interest in these organizations and how welcome our colleagues are really welcoming the opportunity to create this community and to create maybe a safe space to share challenges and to be able to provide tips for their peers. Some of the additional growth that we've had has been to be able to create communities within subspecialty groups, including Latinos in cardiothoracic surgery, who have had meetings at national meetings. They've also hosted cardiothoracic focus webinars aiming to help trainees prepare for residency or fellowship applications. They've been able to partner to develop scholarship opportunities, again, for nurturing Latinos pursuing careers in cardiothoracic surgery. We've also had interest from Latinos in surgical oncology. And again, we're providing opportunities for leadership and professional development. Our most recent in-person event was hosted at the University of Washington in Seattle, where we actually established our first executive council. As I noted, I'm the first appointed president of the organization, and I'm really happy to serve with an outstanding group of surgeons who I really consider more than colleagues, my friends. And we're working on, again, creating opportunities for surgeons to develop similar subspecialty communities, to develop their own portfolio. We've recently launched in partnership with AWS, the visiting professorship. This year, that was awarded to Dr. Mecker Moeller, and she will be hosted at my own institution, Weill Cornell Medicine, to deliver grand rounds as a visiting professor. So I think that affinity organizations provide opportunities for formal mentorship, particularly when you may not find that at a local institution. It creates an opportunity to connect. It also provides an opportunity to connect with near peers, really creating what we call our familia, amigos of LSS. And really opportunities for faculty development. In the future, we also want to really focus on patient education resources. And to be able to do that, we do offer institutions the opportunity to support LSS through institutional membership. that is something that they institutions can sign up their own faculty and trainees, support the organization, and have exclusive benefits as part of that. I will stop there. That is my last slide. I am happy to transition back to you all.
Thank you, Dr. Romero, and thank you for sharing this very beautiful experience from the LSS. And I think now we have the first poll question, and we really encourage everybody to answer to the question, which is, how familiar are you with recent publication on women in CT surgery? So we encourage all the participant to answer to the question, because it will be interesting to open a discussion on the answers. So,
hey, well, thank you all very much for answering this poll question. I think it's telling to demonstrate that while some of our attendees are very familiar with the previous literature on women in CT surgery, there are plenty who have a lot of room to learn, and I'm excited that our presenters today, I think, are going to really advance all of our knowledge in this space. I think we had a wonderful opening presentation by Dr. Romero on the importance of affinity groups, and I think it demonstrates that for us, well, in some ways we're talking about ways that our groups are individually different, and how we as women in CT surgery may have unique and specific needs, that there are a lot of also commonalities. It's not just about being different, but also about being similar, and that there's a lot of things that we can learn from other groups who may have been through similar challenges and similar successes. And so I'm very grateful for Dr. Romero's insight, as I think it demonstrates for us what some of our other organizations, the European Society's group for women in general thoracic surgery, as well as the women in thoracic surgery, both of these groups have a lot that we can learn from other groups such as Latino Surgical Society. And so I'm very grateful to have this continued partnership and collaboration. And we thank you again for participating in this poll. We certainly are going to have a few more questions for the group as we continue on. And we thank those of you who are joining the webinar right now. I know everyone's on different time zones, different schedules around the world, and we're so happy to have additional participants joining us. Just a reminder that you can continue submitting questions to any of the panelists using the Q&A function, and we are going to be having an opportunity for a panel discussion at the conclusion of all the presentations. So we will now go on to our second presentation from Dr. Ugalde on an update on Latin American data on women in CT surgery. Thank you so much for joining us here, Dr. Ugalde. I know you're incredibly clinically busy, so it's a pleasure to have you here.
Thank you so much. It's truly an honor to be here and speak on behalf of my colleagues, female thoracic surgeons from Latin America. I don't have any disclosures related to this presentation. I don't know if you all are aware, but the training pathway in Latin America is very different from the North American pathway. In Latin America, thoracic surgery and cardiac surgery are completely separated. So after medical school, if you want to pursue thoracic surgery, you have to complete your general surgery training, which can vary from 3 to 5 years, and then apply for a thoracic surgery fellowship. And then after you finish both of those, you can take your board certification, which will be exclusively on thoracic or cardiac surgery. As a global perspective, in the US, women represent 8.3% of active cardiothoracic surgeons as of 2021. In Latin America, those numbers are completely different. In Brazil, we have a thoracic surgery society with almost 1,000 members, and as of today, 19% of them are female. Just to give you an idea, when I concluded my training, we were less than 5%. I'm not telling you my age, though. In Argentina, the society has almost 300 members, 13% of them are female. In Colombia, almost 100 cardiothoracic surgeons, 11% are female. And in Chile, very interesting, small society, 23% are female. Yesterday, I was told that the president of the Surgical Society, which includes all societies, is a female. The president of the Department of Thoracic Surgery is a female. And the chief of the largest thoracic surgery service from Chile is a female. Very interesting. As it was already mentioned by the first presenter, unfortunately, there are so many gaps. For me, one of the gaps that I think that we can actively work on is the gap on low enrollment in surgical specialties. We've seen an increasingly number of women in medical school. However, we're still not seeing the proportional increase of female applying to cardiothoracic programs. I think there is discouraged by cultural perceptions, and I believe there's a lack of mentors that could change that. So to change those gaps, we need to increase female representation in training programs. We need to create mentorship programs. We need to encourage societies to offer scholarships for women. And we need to promote more flexible training pathways to accommodate family planning. We also have fewer women in leadership position, as was already stated. And to intervene on that gap, we need to promote women in leadership roles. We need to establish specific programs tailored for women. We need to advocate for gender equity policies in the societies. And we need to encourage gender quotas for leadership roles in the national and regional surgical associations. I believe that work-life balance is challenging. For us, we have long hours, and the physical and emotional stress affect women, especially those with family responsibilities. And we need to take care of that, promoting family-friendly policies, creating different opportunities maybe for those residents that have family responsibility with part-time surgical training, or extend the residency program. More than that, we need to normalize the work-life balance for both men and women to create a more inclusive environment. Gender bias is a huge problem worldwide, but I believe that in Latin America, the effect of the culture also plays a big role. We have implicit biases in hiring and promoting surgeons, and there is a lack of supportive networks that advocates for gender equity. To change that, we need to implement blind evaluation when we recruit surgeons. We need to conduct anti-bias trainings for faculty. I think this is very helpful. We have this type of anti-bias here at the Brigham. I truly believe this can change cultures. And we need to establish policies to ensure equal case distribution in surgical training and practice. Lastly, but not less important, I believe females are underrepresented in research and conferences. There are many studies showing that women publish fewer research articles, and we are underrepresented in the speaker roles and panelists in major surgical conferences. So we need to promote and invite more female speakers. We need to invite them and incentivize them to lead authorship roles and create female-led networking groups to enhance all that. I know that, a lot of maybe negative information, but a lot of also potential things that we as a group can do together, because women remain significantly underrepresented in thoracic surgery across Latin America, but also across North America. We have low number of leadership roles. We have low numbers of academic positions. I believe the culture and institutional biases make it very difficult for women to pursue and sustain careers in thoracic surgery. And I'm very concerned about this, specifically in Latin America. The surgical societies in Latin America need to develop policies to promote gender equity. I think this is feasible and we need to push for this. Only strengthening policies for equal opportunities in recruitment will change the rate of promotion and promote pay parity. Just as a final thought, diversity in surgery benefits everyone. Increasing the representation of women, it's not just about being fair. It promotes patient care, innovation, and overall surgical community. Thank you for having me.
Thank you so much, Dr. Ugalde. What a fantastic presentation. We are all very fortunate to hear from you, and I think it's critical for the audience to recognize that Dr. Ugalde has somehow managed to be a phenomenal leader and established expert surgeon in Latin America and in North America. She's a global leader in thoracic surgery, so we're very fortunate to have her as a representative of women in thoracic surgery, of women in Latin American surgery, and really just supporting and looking out as an ally and a mentor and a sponsor for so many other individuals. And so we thank you very much for your continued contributions to the field, but also for so many people who have followed in your footsteps. At this moment, we have open our next webinar poll question. Have you ever attended an affinity meeting? This is something of interest because, of course, we've heard the importance of affinity groups from Dr. Romero, and Dr. Ugalde has again brought to light so many of these challenges that we have as women, as members of other underrepresented groups, whether it's as a basis of our country of origin or the language we speak or our gender or sexual orientation or so many other aspects of our identities. And so I think, understanding our audience and whether we've had these chances to connect at affinity meetings, whether it's the national meeting of the Latino Surgical Society or the Women in Thoracic Surgery meeting or SBAS, so many other similar meetings. So we would welcome you to complete this. And we thank you, John, for sharing the results. It looks as though just under half of the group has attended these sorts of meetings. This is certainly an excellent opportunity for me to mention to everyone who's in attendance that there will be some mention of an upcoming affinity meeting that we would love for you to attend. So hold tight. Our fourth presenter, Dr. Chang, will be addressing a specific affinity group meeting that we would love to have everyone attend if possible. So thank you very much. And Dr. Rajah, would you like to introduce our next speaker?
Yeah, sure. And we will now move on to Ms. Rajah's presentation for an update on European data on women in cardiothoracic surgery.
Thank you very much for the introduction and for the opportunity to speak today. So yes, I'm going to be providing an update on the European data of women in cardiothoracic surgery over the past couple of years. So to start with a global perspective initially, a study was done in January 2024 looking at the representation of women cardiac surgeons internationally. And they used the CTSNet database looking at the number of registered adult cardiac and congenital surgeons. And overall, it was found that only 8% of the cardiac surgical workforce comprised of women. And regions with increased representation of women included North America and Europe, with women comprising about 10 to 11% of the surgical workforce. And then regions with lower representation included the Middle East and East Asia, where only 2 to 3% of their cardiac surgeons were women. And then moving on to some more European-focused data, this study was done to look at gender representation at European Cardiothoracic Surgical annual meetings. And they looked at registrants at annual meetings between 2017 and 2022 in Europe. So data was collected from 11 meetings, and they found that the number of female session leaders significantly increased over the study period. And session leaders included moderators and panelists. And the increase was from about 10% in 2017 to 22% in 2022. And then they also found that the number of female speakers at these meetings increased significantly between 2017 and 2022. And overall, there were 6,251 abstract presentations across these years, and only 15.2% of these presentations were given by women. The same study had a look at the proportion of female members of both ESTS and EACS, and both organizations had a significant increase of female membership over this 5-year period. And with EACS, their numbers went up from 11% to 16%. And then for ESTS, the numbers increased from 14.5% to about 20.5%. And then also they investigated whether attendance by women surgeons increased over this period, and it was found to significantly increase at the EACS annual meeting from 23.7% to 26.9%. And then it was found that the countries with the highest number of women contributing as leaders and speakers to these sessions was Canada, Spain, the Netherlands, and Austria. And then moving on to some data from the UK. So this study wanted to investigate the impact of gender, ethnicity, and disability on choice of a career in cardiothoracic surgery for UK medical students. So this was given to UK medical students from all 37 medical schools in the UK. And they managed to get 258 respondents, and 62% of those were female respondents. And their main findings were that men were almost 2 times more likely to consider a career in cardiothoracic surgery, and that females were more likely to consider their gender and also their lack of same-sex cardiothoracic mentor as factors influencing their decision to pursue this specialty. Additionally, female medical students were more likely to consider the impact of long working hours on their career choice. Another UK-based study looked at gender representation amongst editorial boards. So they looked at journals relating to UK surgical specialties and identified 10 separate journals. Within these journals, they looked at male and female representation of the editors-in-chief, the associate, section, and deputy editors. And overall, they identified 242 editorial positions, of which 82.8% were held by men. And then on average, 18.8% of women comprise the editorial leadership teams across these journals, with one journal having no female representation in their editorial leadership. And then more specifically to cardiothoracic surgery, the Journal of Thoracic and Cardiovascular Surgery had a ratio of about 6:1 male to female members in their editorial leadership teams. So one of the significant factors, specifically for women as well, in pursuing a career in cardiothoracic surgery is balancing both work and family life. And this study investigated the barriers in returning to work after taking parental leave. So this survey was given to attendees at the ESTS annual meeting in 2023, and then it was distributed via social media afterwards. So it got 152 respondents, and 61% of those were female. And they found that out of nearly half of respondents said that they had breastfed at some point or were currently breastfeeding. But out of those, only 26% had been given flexible hours at work to accommodate for this. And then women were also more likely to think that parenting would affect their career, and they were less likely to feel supported by their employer whilst having children. So whilst there is still progress to be made, there are several societies and workforces within Europe that aim to improve representation of women in cardiothoracic surgery. So there's the Women in Cardiothoracic Surgery Committee that is formed as part of EACS, and they aim to educate and mentor women and support them in pursuing this career. Similarly, there's the ESTS Women in General Thoracic Surgery Committee, and they also aim to support women in pursuing a surgical specialty and organize events and focus on networking to try and increase representation. And then in the UK specifically, we have the SCTS Women in Cardiothoracic Surgery Network, which was formed in 2021. And similarly, they try to increase the representation of women in the UK working in cardiothoracic surgery. And then finally, we also have the Royal College of Surgeons in the UK, who formed the Women in Surgery Committee, which is a national initiative to increase recruitment into surgical specialties. And they have forums a few times a year to discuss factors that particularly impact women and plan initiatives for how they can be addressed and combated going forward. And then there are also several diversity, equity, and inclusion initiatives across Europe, and these are often hosted by the committees that I just mentioned. So, for example, the ESTS Women in General Thoracic Surgery Committee have an academy which is aimed at early career female thoracic surgeons, and they really place importance on education and networking and developing skills. And this is done through a combination of in-person and online events. And the ESTS are also responsible for promoting clinical research fellowships specifically for women, which allows women to engage in clinical research and be supported by grants. And although this particular one, the applications have closed now, these are opportunities that are consistently coming up, so they're always good to look out for. And then we also have opportunities such as this by EACS, which is a traveling leadership fellowship for women. And the real aim of this fellowship is to encourage women to take up leadership positions in the field. And then I'm very excited to say that the Women in Thoracic Surgery organization have been working with ESTS to produce a survey for women trainees that we plan to distribute across Europe and the US. And this is really to help identify key facilitators and barriers to career progression for women trainees across these diverse healthcare systems. So we're going to be considering looking at training programs, work-life balance, the work environment, and family and pregnancy. So be sure to keep a lookout for that in the upcoming months. And then just a final few words from me. I think that although there is still much work to be done in terms of encouraging women to pursue a career in cardiothoracic surgery, as well as making the environment more accommodating towards women, I think that with all of these initiatives, both nationally and internationally, I'm hoping to see lots more active change in the specialty in the upcoming years. So thank you very much for your time.
Thank you, Tanisha, for this incredible presentation and for sharing this data from the European side, and from which I come from, because I'm from Italy. So I found it really interesting, the sharing of this data. But now we are ready for the third question. So which area do you think needs the most attention in future research on women in cardiothoracic surgery? From the results, we see that most of the attendees of the webinar thinks that there are some barriers to career progression for women in cardiothoracic surgeons, and there are some parental leave policies which may be reviewed, maybe revised for helping women. In fact, Tanisha said that Spain and Austria are the countries in which count a great number of members, female members in the European society, because I think that Spain and Austria, they have different parental leave policies, and in particular they have longer paternity leave periods, and instead of Italy, for example. So I think this is something which maybe acknowledge, and we should think about it.
All right, so we will move on to our final presentation. I'm very excited to have joining us Dr. Stephanie Chang. Dr. Chang is the chair of the program committee for the Women in Thoracic Surgery, and she did a phenomenal job helping organize the inaugural WTS meeting last September in San Diego. And she continues to put her phenomenal efforts toward the upcoming second annual WTS meeting that will be in Florida this coming November. And so we do want to encourage everyone to be in attendance and to submit abstracts for that event. And I can't wait for Dr. Chang to share with you all the highlights and best of the WTS meeting. And just a reminder that you all can submit questions in the Q&A function, and hopefully we will have a chance to get to a couple of questions at the conclusion of this final presentation.
Well, thank you so much, Dr. Antonov. So again, thank you for that introduction. And for anyone that didn't know, the Women in Thoracic Surgery had their first annual conference last year in September, and we held it in San Diego right before the World Lung Conference. And so a lot of this planning went into this. It turns out if you're planning something for the first time, you have to put a lot of work and effort into just building the platform for it. And so the leadership committee that was essential for this was Dr. Molina, who was president last year, Dr. Antonov, who was the vice president and is our current president, and Dr. Stephanie Worrell, who is the secretary and is now on the a director at large. I was the program chair, and then some other people that were very essential were Dr. Lytle, Dr. Barron, and Dr. Seppa. And then I think another big shout out has to go to the research committee, which was chaired by Dr. Antonov and Dr. Worrell. And you can see the committee members here, but they had to put together all the different ways to put the abstracts together, grade them, get them out, submit them. And again, it's a huge lift when you've never done it before. So I think everyone did a great job. One thing that I think we're all particularly proud of is we planned for 200 people to come to this meeting and actually capped it at that. We actually sold out for our first meeting. So I think that's fantastic. And hopefully we'll have even more join us in the upcoming one this November. In terms of highlights, so one of the things that people really loved was the speed mentoring session. This was on the first night, and so we had 5 sessions of 10-minute mentoring. There were 73 mentees and 16 mentors, and it was organized by Dr. Bonanno. And we actually had tables like this, and we had different ones talking about career goals, career niche, family planning, research, and different training tracks. And just one of the highlights that we got on the feedback was someone said, I really enjoyed the speed mentoring, both as an opportunity to meet mentees, but also to get to know fellow women in thoracic surgery and their stories. I've worked so long in independent practice, and the ability to meet other women in thoracic surgery helped the field feel less alone. And so I think that was not only about the speed mentoring session, but it just highlights the importance of having this meeting and having a place for all women to gather and meet, to know it's not just you, there's a lot of us in thoracic surgery. In terms of the welcome reception, we had a welcome reception that first evening. This is Dr. Baumgartner, Dr. Antonov, Dr. Higgins, Dr. Molina, and Dr. Patty. And so Dr. Molina actually thanked all of the honorary members of the WTS, and then had some of the mentors in her life who are shown here give some speeches at the welcome reception. Just going to show a couple pictures. These are the fantastic women in WTS and STS leadership. So we know Dr. Blackman, Dr. Antonov, and then Dr. Romero, who's the most recent past president of the STS. Here, this as Talia, who's a med student, with Dr. Nonheim, who was a past president of the STS as well, and Don Huey, who's very prominent in cardiac surgery, and Mimi Seppa, Dr. Molina, and Africa Wallace. And so again, these are all just people who are very active within WTS, and just shows all the fun we had at the welcome reception. Another highlight was, because it was our first inaugural meeting, we actually had a presidential roundtable with all the previous WTS presidents that could attend. So here you can see Dr. Lawton, Dr. Blackman, Dr. Lytle, Dr. Carpenter, and Dr. Donington. And then some of the others that were present but not shown were Dr. Molina, Dr. Burgess, and Dr. Coleman. And so we had 30 minutes to really talk to all of these fantastic female leaders and really get to know them. And so talk about how did the WTS help them in their career, what led to them becoming president, what do they think their legacy was, and where's WTS heading. And it was just a really nice highlight to be able to hear from all of these fantastic women. The other session that actually got really good feedback was this breakout developmental professional development session. So there were two going at the same time. So the first was for trainees, and it was moderated by Dr. Fiedler and Dr. Schumacher. And so Dr. Stephen Yang gave updates on the ABTS. Dr. Pereira actually has been both in private practice and then went back to academic medicine. So she highlighted the difference in both careers and kind of what to think about when you're choosing what you're going to go into. Dr. Verghese talked about the importance of mentorship, and then Dr. Romero talked about family planning. In terms of the faculty session, we had Dr. Carpenter and Dr. Tong moderate it. And so Dr. Lawton, who is at Hopkins, talked about how to not only grow your career, but more importantly, grow your mentee's career, and how to help the next generation of leaders. Dr. Backus gave a great overview of all the different national societies and the leadership programs out there and how to have career advancement in those areas. Dr. Blackman is actually in charge of the Lung Institute at Baylor College of Medicine, and so she gave a great talk on branding and reputation. And then Dr. Chikwe is the editor-in-chief of the Annals of Thoracic Surgery, and so she gave a really insightful talk on not only how to get involved in the academic journals, but just how to give a good review, what it takes to be on an editorial board, and sort of how to help contribute in a meaningful way to these journals. I thought personally my favorite talk was the presidential address from Dr. Molina. You can see here her giving her talk. And so it was titled Courage to Change, Working Together to Shape the Future of Thoracic Surgery. And, you know, one of the main points that she made was just how we as women shouldn't have to change to fit into the already existing field, but that we should be who we are and we should be our authentic selves, and we can actually help change the future of thoracic surgery and make it a better place. And so I thought one of the quotes that she had that really highlighted it was, authenticity is a collection of choices that we have to make every day. It's about the choice to show up and be real, and the choice to let our true selves be seen. And so I just thought it was a very lovely presidential talk, and I thought it was fantastic. And then just to highlight some of the abstracts that we had. So we had two oral scientific sessions, one for thoracic, one for cardiac, and we did actually assign winners to each of these for the best presentation in each group. So Dr. Marissa Michael from Weill Cornell won for a high PD-L1 expression in tumor draining lymph nodes, correlates to enhanced tumor response in neoadjuvant chemo-IO and non-small cell lung cancer. And then I cannot pronounce his last name, but Dr. Brylechik from Baylor College of Medicine won for lower socioeconomic status impacts outcomes after CABG, a nationwide analysis of over 500,000 patients. And then we actually did have a poster session as well. And so you can see we had a lot of posters across cardiac, congenital, thoracic, and workforce. And here you can actually see this is Dr. Aka presenting her poster that did win for the cardiac congenital one. I'm talking about embryologic origins of aortopathy. And so these were the three winners for these best posters. And then the final highlight of the night was the presidential gala. So here you can see in the top left corner all the past and current presidents of the WTS at the gala. I honestly have no idea what's happening in this picture down here, but I thought it was fantastic. I think everyone was getting together and doing a can-can. And then here you can just see some more fantastic women. So Melanie Edwards is the current president of STSA. Dr. Antonov is the current president of the WTS. Dr. Romano is the past president of the STS, and Dr. Schumacher is just awesome. I feel like that's a title in and of itself. And so just for everyone, I know Dr. Antonoff mentioned it, but we are going to have our second annual conference this upcoming November. It's going to be on Omni Amelia Island Hotel. Our abstract call opens on May 1st, 2025, and we would love to see you all there. And it's actually going to be right before the STSA, so you can actually have 2 for 1 if you come.
Thank you so much, Dr. Chang, for the wonderful presentation and helping us recollect some of our very fond memories of the inaugural WTS meeting. We are certain to recreate the same environment and energy at the second annual meeting, and we hope to have everyone join us there. And honestly, we hope to bring individuals from many of the other organizations globally to come join us, just as we would love to have reciprocity and to continue the global relationships and bring members of the WTS to other parts of the world so that we can all continue to further these relationships and build on our commonalities and the challenges and the strengths and the benefits and the wins that we all are so grateful to have. We are running very short on time, but this has been a really phenomenal group of discussions, and we do want to have some time for some questions. There are a few questions in the chat, and I think a couple of them specifically would be great for Dr. Ugalde to kick off. There's a question, of course, thanking Dr. Ugalde for being such a wonderful role model and asking what she'd recommend regarding policies that the Latin American societies may need to improve, but also another question about why is it difficult to have women surgical societies in Latin America. So maybe you can kind of address both of these questions, Dr. Ugalde.
Thank you. Thank you for the questions. I think that for the societies specifically in Latin America, we don't have mentorship and sponsorship programs. For instance, WTS, which is proportionally a small society compared to others, has multiple mentorship and sponsorship programs. Why the Brazilian Thoracic Society with 1,000 members doesn't have any programs? We need to fight for those. We need to create leadership development and representation training programs. We don't have them. We should develop them early on in their career. And I think that the societies are best suited for that. Societies can also play an important role in the grant and research fundings. We don't have them in Latin America. Societies could play an important role in giving examples and creating programs that will promote work-life balance and family support for residents that are having small babies, or small babies is funny, having babies, and they have their own complex family setting, and that can somehow get in the way of the training program. So I think that the societies can have a lot of impact if they promote and they create programs specifically for young females in training and for females that are starting to pursue their careers. Why we don't have specific female societies in Latin America? The short answer, in my personal opinion, is a cultural issue. I think that what Dr. Romero is doing in North America is feasible, but if she was in Puerto Rico creating this problem, she probably would face a lot of cultural resistance. People tend to think that those things don't exist in Latin America, that we don't have any biases, that there is no need to promote awareness. So I think that culture is a major issue in Latin America, and that creates a lot of barriers.
Dr. Romero, do you have any thoughts?
Yeah, absolutely. Thank you so much. I appreciate the kind words. I think there's a true need to partner with the major organizations, and as we think about inclusion, right, that we think about inclusion of women, and then you get into inclusion of LGBTQ, for example. So what is important to establishing these organizations don't be afraid to go grassroots and start with, we actually modeled ourselves after AWS. It's, very well-known story. Patricia Newman put up a sign and said, "Women, join me for breakfast on this date," during the clinical congress. And that's how AWS started. Literally, that's what we did. We said, "Hey, join us for breakfast at the ACS." And that's how we started. And, it's incredible to think that I've been working with LSS for more than 10 years, but we've really grown tremendously. And and everybody that I've spoken with still says, I can't believe it didn't exist before. I can't believe we didn't have a group. I can't believe we didn't have a space." So know that it's needed and that it will be welcome from the people who really need to create that community.
That's terrific. Thank you so much. There's another question in the chat about how to get equity for the inclusion of women surgeons from smaller countries in the bigger meetings, larger societies, and et cetera. And I think this is a huge challenge. I do know that the ESTS, Women in General Thoracic Surgery Group, has been working really hard to do this, and a lot of the efforts being put forth through their academy, led by Dr. Pompili, have been really phenomenal in trying to get women from some smaller countries. But this is obviously an ongoing challenge. And, it's, again, we can talk about the challenges that I may have as being, the only woman in a group of 9 men, but there are plenty of other women colleagues regionally and nationally with whom I can connect. And we recognize that in some countries, there may be only be a handful of women in the entire country practicing their specialty. I think for us, those who lead some of our larger societies, the burden is on us somewhat to create opportunities, scholarships, educational opportunities to help elevate these women and make sure that they have the sponsorship that they deserve and maybe not have access to elsewhere. But I'm eager to hear from the panel what other ideas you all have on ways that we can really globally help some women in our specialty rise. Any thoughts from anyone else?
I'll chime in just to say that the American College of Surgeons does host a Latin American Day, and that's actual programming built in to really bring in Latin American surgeons. Some of the content is actually sometimes presented in Spanish. Similarly, I've seen other organizations that I'm a part of create different membership pricing for low and middle income countries. And so, it's very different to create membership dues that are, simply just not reasonable when you're talking about the difference in salaries. And so being cognizant of how can we create truly inclusive membership for our colleagues in other countries who can really contribute to our knowledge and to our expertise and valuing their contributions. And I'll give the last example from the American Association of Endocrine Surgeons. Our past president, Carmen Solorzano, just established a scholarship specifically to fund surgeons to travel to the AAES from Latin American countries to be able to create these types of opportunities. So I echo what you said, Dr. Antonoff. It's really important that we recognize our privileged position as practicing surgeons in the US, but also I think it's really important to use these organizations as a vehicle for opportunities for other surgeons and the future generations of surgeons.
One of the great things that the WTS did 4 years ago was to create a membership due specifically for Latin American surgeons. That was a great initiative by Dr. Molina, the time president, which I hope Dr. Antonoff will continue to pursue, and then work on creating specific programs for females from maybe either developing worlds or countries or low-income countries. Trying to group them might be easier for the societies, because if you focus on specific countries, might be difficult to please them all.
Terrific. I totally agree. We have 2 remaining questions. I hope we can address them very quickly, and then we will.
And it's for you.
Our webinar. Yes, I would love to answer this question about balanced life for women. And it's interesting. The question states, I've heard from male colleagues that it's impossible for a woman to have any kind of balanced life as a CT surgeon. Is this truly the case? There's a lot to unpack there. That men surgeons are saying that it's impossible for women to have a balanced life, and I think part of that is that we're addressing here that this is men's perceptions of what balance feels like to women. And so, for starters, I would say that no man is in a position to tell a woman whether her life feels balanced or not. I can also tell you as a middle-aged woman with 4 children that I don't know any middle-aged women with 4 children who are cardiothoracic surgeons, cardiac, thoracic, general surgeons, endocrine surgeons, stay-at-home mothers who necessarily feel that their lives are balanced. Life is very finite, and we know this, and we choose to spend our time and effort and energy in the ways that are of value to each of us. And I think we need to determine if we are balanced in our own right for each of us as an individual. And my balance may not be the same as Dr. Romero's or the same as Dr. Chang's, but we each need to find our own balance. So I think the first point there is that I would not let anyone tell you what balance means to you. I also try to step away from the term work-life balance because it suggests that one thing gives, another thing takes. And I think we all are really focused more on how can we integrate our lives with the different aspects of our lives. We're surgeons. We don't lose that identity when we become a sister or a wife or a mother, but we also don't lose those other identities when we go to our workplace, and we bring all of the strengths from those aspects of our lives to make us stronger surgeons. So I think, it's important to focus on integration. And ultimately, I think while we could have an entire separate webinar on this topic alone, I would encourage everyone to recognize that it's really about the finite amount of time we have on this planet and how we choose to spend it. And for me, work-life integration is all about time management hacks. And, I think having a network of other individuals who maybe share some of the similar burden load, and understanding how they manage it and how they use their time and how they get everything to integrate in a way that results in a quality of life that they enjoy and is meaningful is valuable. And perhaps historically why it felt that things could not be balanced was that we didn't have other people that we could talk to sort out how they're making it work. But also it's important to have groups like these groups that are all what we've discussed today to advocate for the needs to make adjustments and balance and integration feasible and possible and doable for people. But, I think Dr. Ugalde specifically called me out as someone to answer because I do feel that I'm very much actively engaged in the lives of all 4 of my children who range from 7 to 17. And I feel that I'm very much present for my trainees, for my patients, their families, and the organizations in which I participate. And so I think, again, it is possible. And I think for many of us, it's important to turn off those external voices. I know there are more questions. I also know that all of the panelists who are here today are very, very present and approachable and eager to answer anyone's questions going forward. And I want to be respectful of everyone's time. Any last closing words from any of the panelists before we close out the webinar?
Muchas gracias. Thank you so much.
Thank you for attending the CTSNet Women in Thoracic Surgery and European Society of Thoracic Surgeons Women in General Thoracic Surgery webinar. As a reminder, a recording of today's webinar will be available next week on ctsnet.org and CTSNet's YouTube channel. Please take a moment to fill out our brief survey that will appear as you leave this session. Your feedback is greatly appreciated. Look forward to the next 2 webinars in this series. Webinar 2, Regions for Opportunity, State of Women in CT Surgery, will take place at this time on April 17th. Registration is now open. Have a wonderful rest of your day.